And joining the conversation tonight is infectious disease specialist Dr. Amesh Adalja. We thank you so much for joining us to talk about this tonight. First, I just want to get you to explain what exactly Ebola is and why it's such a threat. Because for many years, Ebola was seen in disaster movies where outbreaks happen. But this is something that's very real, and we're seeing it play out right now in Congo.
So Ebola is a virus that was discovered in 1976 with a pair of explosive outbreaks in Sudan and the DRC. And it's now become kind of a mythic infectious disease where it has very high mortality rates, creates a lot of panic, and can really take over in a given region. And we saw that with the West African outbreak in 2014, where you had tens of thousands of cases spread to multiple different countries. And this disease had for a long time had no vaccine, no treatment, and we just kept hearing about these 90% mortality rates and no real source. Nobody knew where it was coming from. All of that's changed a little bit, but Ebola is still a major problem, and this outbreak is evidence of that.
You said all of that has changed a little bit. How has it changed now?
Well, we know a lot more about Ebola now in 2014, from the 2014 outbreak than we ever did before. We know how to treat it. We know about good supportive care. We have an experimental vaccine that is highly effective. We have multiple experimental drugs that seem to be pretty effective. We've dealt with a lot of the after complications, people who have prolonged transmission, maybe because of sexual transmission, because it lives in the genitals. We've seen long-term complications in eyes. We know a lot more about it. And despite all of that, it's still been a challenge in this DRC outbreak because of the society where it's occurring, the community outreach and engagement. And that's an important point that we learned in West Africa, that even though we might have the best ideas epidemiologically about how to stop this virus, if the public isn't hearing that, it's not going to work.
Now, we saw what happened here in the U.S. back in 2014. There were two nurses who were treating a patient in Dallas who became infected themselves. But talk about how quickly this could spread if it manages to find its way out of the Congo, Democratic Republic of Congo.
So it's important to remember that Ebola is a scary and deadly disease, but it's not very contagious. It's spread through blood and body fluid. So when you're talking about infectious diseases, that's not a very efficient way to spread. You need to be in contact with literally someone's blood or vomit, for example, in order to get infected. This isn't like measles or flu. So we may see regional spread, and we've already seen cases in Uganda, and there are countries that are neighboring the DRC that have been preparing for spill of this into their countries. However, when you get this virus into industrial areas, like, for example, what we saw in the United States, the spread is very hard. It's very hard for this virus to spread in those types of places because it's not very hospitable, because we don't have that level of blood and body fluid exposure like you're seeing in some of these African nations, where you have, for example, people handling dead bodies, people not being treated in appropriate places, shortages of gowns and gloves. All of that really allows Ebola to spread in a way that wouldn't happen in the United States. And it really was a fluke that we had those two nurses get infected in the United States based on some errors really that happened in that hospital.
Very quickly, do you think that the world should be paying more attention to this now?
I definitely think the world should be paying attention to this. In the infectious disease community, we've been watching this for over a year, getting worse, trying to sound the alarm, and nobody has really paid much attention. And now what we're seeing is an outbreak that has spiraled out of control in the DRC. For example, we don't even know if we're catching all of the patients that are sick. We're not vaccinating the right people. We've had record numbers of people vaccinated, but still this outbreak is continuing, which means that there's a shadow epidemic of cases that aren't being seen. So I do think the world should pay attention, because it's much easier to stop it now in this earlier stage than it will be if it spirals to a West African type of level.
All right, Dr. Amesh Adalja, thank you so much for your time tonight. Appreciate it.